Yeah, we will convene the Health Committee sub and the House Committee today. We have a quorum stacked up here. Madam Clerk, if you'd call the roll, please.
Representative Boyd. Here. Representative Byrd. Representative Freeman. Here. Representative Hall.
Here.
Representative Jernigan. Representative Kumar. Representative Marsh. Representative Ramsey.
Here.
Representative Sherrill. Here. Representative Smith. Representative Terry.
Thank you. Do we have any personal orders this afternoon? If none, we do have a calendar. We will proceed with that calendar. Item 1 is House Bill 142. I think this is going to be presented by Chairman Terry. You're recognized. Have proper motion and second.
Thank you, Chairman. There is an amendment that makes the bill, amendment number 4481.
Proper motion and second on the amendment.
All right. Thank you, Chairman. This is the TANF Opportunity Act, and it is a collaborative piece of legislation between the administration, DHS, Commissioner Carter, and the TANF Working Group, forth by Lieutenant Governor McNally and Speaker Sexton. And while I chaired that working group, I really want to give recognition to the members of that working group. Senators Watson, Dickerson, Akbari, and Senator Hale had something to do with this as well. And also thank the efforts of Rep. Smith, Rep. Hawk, and Representative Love. As the members are likely aware, DHS receives a yearly recoupment grant of $191 million to go towards TANF, and the state of Tennessee has amassed a reserve of well over $700 million. DHS may utilize those funds with 4 main purposes in mind. Number 1, provide assistance to needy families so that children can be cared for in their own homes. Number 2, reduce dependency by promoting job preparation, work, and marriage. Number 3, prevent and reduce the incidence of out-of-wedlock pregnancies. And number 4, encourage the formation and maintenance of 2-parent families. And DHS utilizes the TANF funds in 4 main categories to achieve those purposes. And those categories are cash assistance, a reserve, workforce development, and with community grants. This bill addresses each of those categories while enhancing protections against fraud and abuse of the TANF system, of the TANF program. What this bill does, there's 4 main parts: program integrity protections. It increases the penalties for TANF and SNAP fraud. And then secondly, it ensures the confidentiality of personal information for individuals who report fraud. Number 2, the incentivizing self-sufficiency for families portion does increase the cash assistance allotment while keeping us, we are still conservative and in the lowest 20 states. It also has the Pathway to Prosperity pilot program, which incentivizes recipients to improve their workforce skills via education, trade school, and apprenticeship. The third part, the TANF Reserve Investments, has 3 parts. It has a TANF Advisory Board, which will evaluate the efficacy of the programs. It also has a Family First Community Grant Program of $50 million. And then there is the Tennessee Opportunity Pilot Program, which will help Tennessee develop proven and effective community wraparound services for recipients. And number 4, we have the unspent annual award, so it keeps our reserve at a level to ensure funds are getting either to the recipients or via wraparound services in the communities. But it ensures that Tennessee does have funds available in case of a downturn. And with that, I'd be happy to take questions, or we could, if we had questions for DHS, I think they're on as well.
Okay, we certainly thank you for this bill. This has been a big issue since it was first reported a year or so ago, and we want to thank Chairman Hawk. He had a parallel bill that you guys seemed to draw together and so helped each other out. Do we have any questions or comments on the amendment which makes the bill? If none, we'll be voting on the amendment which makes this bill 142. All those in favor say aye.
Aye.
Any opposition? So approved. So we're back on the bill as amended. Do we have any comments or questions on the bill as amended? If none, we'll be, Chair Lady Smith.
I just want to thank you, Mr. Chairman. I just want to thank our 2 chairmen, Terry and Chairman Hawk,
for collaborating. This is a best practice that we're seeing in the State House, where two really good proposals have been married together. And I want to make sure that the work of the TANF working group has been honored too. I think last year the leadership of both of the House and the Senate made a really good effort to jump on top of what we perceive to be a problem and work together. So I want to pay tribute to both of our chairmen that are present today, also the Department of Human Services, and a great welcome to Commissioner Carter, who is already on the job day one and showing us what good looks like. So I will be gladly supporting your bill. Thank you.
Great comments. We have further comments or questions on the bill as amended? If not, we'll be voting to send this bill to the full committee. All those in favor say aye. Aye. Any opposition? So approved. Thank you. Next on the calendar is item number 2, House Bill 705. Representative Russell, you're recognized. We have a proper motion and second on the bill.
Thank you, Chairman. Thank you, committee members. House Bill 705 does two things. It adds vaping to the Non-Smoker Protection Act. As a result, vaping will now be prohibited in the same places that smoking is prohibited. And the second thing it does is treats vaping the same as tobacco in the preemption section of the code. In other words, the state will regulate the vaping policy with respect to where vaping is allowed to have uniformity across the state of Tennessee.
Okay. We have a proper motion and second on the bill. No amendments. Representative Freeman, you're recognized.
Thank you, Mr. Chairman. Sponsor, thank you for this bill and including vaping in the same Non-Smoker Protection Act. I do have an issue with removing local oversight to this. And can you give me an example of some of those local oversights that we'd be preempting as a state?
So basically, by making this uniformity across the state of Tennessee, this will prohibit people from going from one location to the other, not knowing the ordinance of the cities. So it's just uniformity across the state, and that way they're not inadvertently breaking the law.
Yes, Representative Freeman, sorry.
Yeah, so thank you. And the actual answer I was looking for, and you did a great job by not answering it, I'm kidding, is that a lot of local municipalities limit some of the enticing flavors for youth to get hooked on vaping. And to all the members here, I would just really encourage you to think about what we're doing if we pass this legislation. We should be looking at this in two separate items. One, protecting the non-smokers and including vaping in that piece of legislation. And two, we should be doing all we can for young children across our state who are being enticed to start smoking, start using tobacco products by selling vaping flavors like bubble gum, like Fruity Pebbles, like grape soda. There is only one reason you do that, and it's to entice younger kids to begin smoking. We used to have doctors that would talk about this is the best cigarette to smoke, it's the healthiest cigarette to smoke. And we outlawed that. And I'm afraid if we continue down this path, we're going to have another generation of people addicted to nicotine and tobacco products. Thank you for bringing the legislation. But as we vote, I hope everybody thinks about what I just said.
Do we have further comments or questions? I'm compelled, I think this raises the age to 21. Am I correct about that?
Chairman had already raised it last year to 21.
Okay. And I had been contacted by Nashville Health to raise a concern that the bill's great, the reduction in exposure to vaping is great, but the taking away the preemptive status of local governments is a concern to some of these organizations that actually do advocate for health in different areas. I think you made it very clear that that's one of the purposes here is to take away the preemptive ability of local governments, and of course that sounds reasonable when you say everybody should be operating under the same regulations. However, my county, the Board of Health 5 years ago had actually lumped in vaping products with tobacco products, so we were way ahead of the curve, and the only way that we got to do that was having the preemptive ability to pass an ordinance. So I would caution you, if anybody, I don't know if we had anybody on the list to speak about this, not so I was compelled to make that statement, and if there are no concerns about that except for the chairman here, I guess we'll just move on. So further comments or questions? If not, we'll be voting to send this bill to full committee. All those in favor say aye. Aye. Any opposition? No. So approved.
Thank you.
Representative Russell, do you want to take care of that other bill you got on the calendar?
I don't know that I got another one.
House Bill 411. It makes reference to Federal Highway 411. There's between mile marker 81 and 91. There's a section that was dedicated to Sergeant Lowell Russell, and this bill establishes a toll road on that section of the highway. It's got a great fiscal note. I mean, there are huge revenues for the state, but 50% are dedicated to the Tennessee Highway Patrol retirement home in Corntassel, Tennessee, and the remainder goes to cheeseburgers and aviation gas. Is that
So
do we
what
have
we're
a
trying
proper
to
motion
do?
second?
Yeah, what we're trying to do on that is make it where when a vehicle passes, it automatically deducted off the credit card.
There you go. I always make it easy.
Thank y'all.
Okay. We have item 3, which is House Bill 137 by Chairman Hawk. You're recognized. Have a proper motion second on the bill. And this is your other bill. I think this is the one that's not rolled into the TANF.
And
reorganization.
Chairman and members, thank you so much. And as Chairman Terry did such a great job, and Chair Lady Smith as well, explained what we've done. In good faith conversations with Department of Human Services, Chairman Terry and all folks involved, our working group involved in this legislation, I believe that we're at a happy place. And this has definitely been a collective work that a lot of folks have come together. This is 7 days a week for the last 6 weeks to come up with this, Saturday nights, Sunday nights. Not that I ever had a social life in the first place, but I definitely have no social life now. That being said, I understand that the amendment that the committee just adopted is 85 to 90% where we need to be. I have the understanding and the commitment from Chairman Terry that there's a couple of issues that can be taken up in full committee with an amendatory language that's going to be taken care of that will essentially perfect the legislation that we've got. So I'm very comfortable with Department of Human Services, Chairman Terry, and where we are. In good faith, I would like to take this bill off notice so we can move forward with one vehicle that we are going to have some substantially good legislation to, in 2 words, strengthen families. And that's where we want to be. So thank you, Mr. Chairman. And without hesitation, I'll move this bill off notice.
With no objections to that, will you please let us know when your social life gets back up to the peak, and we'll know how to get a hold of you.
That's a loaded question right there. So thank you,
Okay.
Mr. Chairman, members.
All right, thank you, sir. Item 4, House Bill 626 by Representative Hicks, you're recognized. Have proper motion and second on the bill.
Thank you, Mr. Chairman. Thank you, members. Before I get into the talking points of this bill, I would be remiss if I didn't thank Chairman Hawk for his leadership last year on this issue. He had actually passed this bill through the Health Subcommittee prior to us adjourning for COVID back in mid-March. And he was kind enough to let me champion this moving forward this year, and I'm very grateful and thankful to him for that. Thanks for your leadership on this issue. We all know that the opioid crisis has hit our state very hard, and pregnant women are not immune. According to the National Institute of Health, every 15 minutes a baby is born suffering with opioid withdrawals. Last time I checked, Tennessee was ranked second per capita in the U.S. for a rate of opioid abuse. According to our friends at the Tennessee Association of Alcohol, Drug, and Addiction Services, women are more likely than men to receive prescriptions for opioids. They also develop mental and social consequences of addiction faster than men, often finding it harder to quit using addictive substances, and are more likely to relapse. Some estimates tell us that close to 5,000 pregnant women will need access to addiction treatments each year in Tennessee. Using opioids during pregnancy can result in a drug withdrawal syndrome in newborns called neonatal abstinence syndrome, which I know this committee is very familiar with. And our Department of Health has taken an active role in prevention and supportive treatment efforts for which they should be applauded. But opioids are not the only problem. We see pregnant women suffering from alcoholism and other substances that, again, not only affect women, but the child she is carrying and that she has recently given birth. The Tennessee Association of Alcohol, Drug, and Addiction Services, better known as TAADAS, surveyed both nonprofit and privately operated residential detoxification treatment center in Tennessee and found that many previously barriers to pregnant mothers attaining treatment, such as lack of treatment facilities that will admit pregnant women, lack of treatment facilities that provide recovery support for women through their pregnancy and postpartum, lack of child care for women in treatment, lack of transportation for these women to get treatment, and of course, lacking of funds all present significant issues. TAADAS found that of the current 43 medical detoxification programs, only 19 were available for pregnant women. Many facilities do not admit pregnant women, and others only admit them under strict medical monitoring for a provider specializing in high-risk pregnancies. On any given day, there are very few state-funded beds available in Tennessee for women and men, and a long waiting list is the norm. The current residential detoxification treatment programs that serve pregnant women have a wide range of admissions criteria. Most programs state that they take pregnant women on a case-by-case basis, and if they accept pregnant women, most only serve women between the 8th and 34th week of pregnancy. Additionally, the Centerstone Research Institute study of this population in 2015 found that for mothers living in rural areas, concrete needs were described as especially salient. All the providers described that rural families struggle with basic needs. The same study also found that transportation in rural areas are greatly affected access to treatment. We must focus on building treatment capacity for pregnant women as the first step toward promoting positive health outcomes. what this bill does. House Bill 626 is really about making government work better for the citizens who needs it the most. This legislation will require our department coordinate services that will assist those pregnant women and mothers with children who are seeking recovery assistance. House Bill 626 requires departments of Human Services, Child Services, Health, and the Bureau of Teen Care to actively seek and apply for federal, private, or other available funds and actively direct state funds for the development of recovery programs to assist mothers who are pregnant or have children and are struggling with opioid and other dependencies. This legislation assures that our state is doing all we can to coordinate and pool these services who need it the most. We must do more. I am hopeful that this General Assembly can keep the focus on increasing access so we as a state will be able to better support women and families who need addiction treatment. Thank you, Mr. Chairman. That sort of reads the bill. I'll be happy to answer any questions, and Chairman Hawk is here as well, if we can answer any questions.
Sure, we appreciate the advocacy for this little supported group of folks across the state. Do we have any comments or questions about the bill from the sponsor?
Yep. Sure.
Do you have proper motion and second on it, Chairman Jernigan?
Yeah, no problem. This is your first bill?
This is my first bill in this
committee?
In
Gotcha,
this
okay.
committee.
I was wondering because the explanation's probably longer than your bill. But,
I'm doing what I was told.
Some of us are going to have to go back and shave before we continue.
good job.
Comments or questions? We had insinuations that this committee had full of hicks, but not up until this point. No, I appreciate that. Very kind, and don't, when you present this bill, do not be afraid to let the world know exactly what it does, because this is a very unrepresented group of people. They don't have much of a voice. Further comments or questions? If none, we'll be voting to send this bill to full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, Mr. Chairman. Thank you, committee.
Great job.
Thanks a lot.
Great job. Now the trouble starts here. Item 5, House Bill 226 by Chairman Vaughn. You're recognized. Now, I think we've got an amendment, maybe that, does it make the bill? It does not make the bill. It's a clarification. Okay. Go ahead and we have proper motion and second on the bill. Go ahead and discuss the bill.
Thank you, Mr. Chairman, and I appreciate the fact that y'all supply vaping while we're here in the meeting. Every time I come in this room, I'm thinking that my vision's impaired, and it's the haze that's coming from our sterilization system. One thing that I'd like, the bill that I'm presenting in front of you today has its origins in the pandemic, the early days of after they put the COVID on us, and we started looking into the best ways to deal with pandemic, and one of the replies or responses to this was testing. We've got to get more testing of everyone. Well, what we figured out quickly was our supply chain for testing was stressed to the max. We had difficulties getting test results turned around. We had the sheer volume created impacts for communities in getting test results and really hampered us in those days. What we believe we're presenting here today is a solution to help fix the supply chain of laboratory personnel. We've got some very burdensome regulations on medical laboratory folks. And what this does is basically taking some of the actions through executive orders, pulling those things out that have worked and we believe better serves the public, and making them into code. The Medical Laboratory Act initially was passed in 1967, and at that time, CLIA, which is the federal, it's another acronym, and I've gotten to where I just can't say anymore. We're going to call it CLIA. it was not in existence. And during those early years, the state's Medical Laboratory Act served us well. But since then, the national standards have been established and the need for state regulation has lessened. Right now, only 11 states out of the 50 licensed medical laboratory personnel. The balance relies upon CLIA to establish requirements for medical lab personnel. The Mayo Clinic in Minnesota, they're one of these states, and I think everybody can attest to their ability and their expertise. So what we're doing here today is asking us to allow us to observe the federal regulations, to make substantial changes to the Medical Laboratory Act, and to streamline the ability for personnel to work in these laboratories so we can turn around results faster and quicker, and we basically adopt the practices that we've seen over the past year that have served us well. Today with me, I have an expert in the field with me today. If the committee would like to hear some testimony on this, Dr. David Smalley, so American Esoteric Labs, I think we have him down on the list to speak. And so if you have some specific questions with regards to what this means to a real-life business that's been out there on the front line trying to put results out, put valid quality results out for community health, he can share some of the problems and why we brought this forward. So if you would, but that's at the committee's discretion, Mr. Chairman.
Yes, and let me with staff here get in the proper standing. This amendment 4030 does make the bill, so let's go ahead and get a proper motion in second. We have that on the amendment that makes the bill, which you've described to us. Okay, that's full clarification. And I do appreciate the explanation. I got a call early in the pandemic. I got a call from Erlanger, and one of the residents said we're shut down, so we can't get any tests. The tests are taking 2 weeks to get back from California, and we got people right down the street here that could do it, but they're not certified. And so Chair Lady Smith straightened all that out very quickly, and the governor had an executive order. So I've gotten mixed reviews. My hospital likes this bill. They called me and told me to support it. Just heard from UT Hospital that they had some issues with it. So I don't know. I'm prepared to vote for it, as my local hospital told me. But if there are any questions or comments from the sponsor, or anybody want to hear from any testimony, yes, Chair Lady Smith.
Thank you, Mr. Chairman. And I would like to hear from Dr. Smalley, I believe. I have, as our chairman mentioned, the Baylor lab, which is the Baylor High School lab, which is a very unusual setup. But I would love to hear the testimony and offer some exchange comments, if you wouldn't mind, Mr. Chairman.
Yes, we will go out of session and hear from Mr. Smalley, Dr. Smalley. If you'd identify yourself.
Yeah, my name is Dr. Dave Smalley. I'm the president of American Esoteric Laboratories in Memphis, Tennessee.
Yes, you would just tell us your feeling.
Sure. Well, as reported, this law came into play in 1967. And during that period of time, there was no legislation across the country that helped regulate clinical laboratories. And as labs became more and more sophisticated, it was necessary to have minimum requirements for education, training, and so forth for personnel, as well as other aspects of the law. In 1988, the Clinical Laboratory Improvement Act, which is known as CLIA, was passed. And in the federal legislation, 1992 it was implemented. So we've had that process in place since 1992. 39 out of the 50 states only follow the CLIA regulations. Out of the 11, there are only about 3 that actually have testing personnel requirements. So we're one of the exceptions. The problem is with the state Medical Laboratory Board. It's actually now become more complex in being able to get licensure and so forth than any other state. It's required us to have problems in meeting those guidelines, recruiting people from outside the state of Tennessee, and being able to get people in. One of the things that was really felt here, not only in Tennessee, but across the country, 65% of the medical laboratory training programs across the U.S. have closed. 65%. Of those that are still in place, the amount of graduates are markedly diminished. As an example, I was a professor of pathology and laboratory sciences at UT Health Sciences Center for over 25 years. I continue being a member of the Dean's Council at the College of Health Professions. If you look at the other professions, the allied health professions across the country, if you take an example, I attended the last advisory council, physical therapy. They admit 60 people per year. They had 600 applicants. The speech pathology, they admit 40 new students every year. They had 400 applicants. Clinical laboratory sciences program, they avoided talking about recruiting. I asked them the question, what is your recruiting? Where are you at? They had a total of 13 applicants, 13 total applicants. They accepted or were able to accept 8. If you look at across the state of Tennessee, in Memphis, Nashville, Chattanooga, Knoxville, every one of those places have anywhere from 40 to 100 open positions that they cannot fill. So by being able to update this process will give us opportunity to recruit people with baccalaureate degrees, allow us to train them effectively.
Okay, do we have any comments or questions? Chair Lady Smith?
Thank you, Dr. Smalley. And I want the committee to hear that this is beyond COVID, if I might, Ms. Dr. Smalley, because as Chairman Vaughn mentioned, this problem was uncovered during COVID. But I was just on a Zoom call this week with Life Science Tennessee, and one of the shortages in our health care workforce is in the space of medical laboratories. And what we're doing is we're preventing our state from being a leader in the health and life science and bioscience field if we're not offering a complement of personnel to welcome in life science people, manufacturing. And so while this indeed has been an uncovered problem through COVID, we really need to right size and address the fact that we're losing to places like North Carolina with a lot of very advanced technology and study. And so I want to thank you for bringing this bill, Chairman Vaughn, but also the fact that thank you for your leadership, because this is very important for us to be able to compete with other states. Thank you, Chairman.
Further comments or questions to the witness? Yes, Dr. Kumar.
Thank you, Dr. Smalley. Why do you what is the reason you said 65% of the facilities have closed? What is the reason for that?
The vast majority of the programs were hospital-based. They had affiliations with colleges and universities, and many of the hospitals, as economics impacted the hospitals over the years, were unable to support a training program for such few people. And so the hospitals relinquished that to the universities and colleges. So as an example, in Memphis, the Baptist Hospital had a training program. The Methodist Hospital had a program. Back in the day, St. Joseph had a program. St. Francis had a program. Now there's one at the University of Tennessee. There's one at the Community College and one at the Baptist College. Totally, out of all 3 of those programs, the associate degree level program produces about 15 graduates per year. The other 2 together are less than 15.
My only concern, thank you for that explanation. My only concern is that are we lowering the standards because we cannot recruit people? kindly assure us that we are not lowering the standards and the testing will continue to be at the same high level it has always been, and we'll be fine with it.
Dr. Smalley?
The national standards under CLIA actually define personnel requirements. And so, for instance, for high complexity testing, they require a minimum of an associate degree. And in fact, that's exactly what the military does. So the largest military or medical system in our country does that same process. The baccalaureate degree that we would require gives us the opportunity to do specific types of training, and it actually may improve our capabilities because of the ability to recruit more people and train them more effectively.
Thank you for your reassurance, and thank you for coming.
Do we have further comments or questions of our testimony? If none, we will go back out of session. And thank you, Dr. Smalley. We appreciate that explanation. And Mr. Sponsor, you're recognized.
Thank you, sir. I could have said all that, but it sounds better coming from him.
Yeah. Do we have further comments or questions of the sponsor on the amendment? If none, we'll be voting to put the bill with the amendment on it, approve the amendment. All those in favor say aye.
Aye.
Any opposition? So approved. We're back on the bill as amended. Any comments or questions? No objections. We'll be voting to send this to full committee. All those in favor say aye. Any opposition? So approved.
Thank you for your support.
We have item 6, House Bill 11-5. Have a proper motion and second on the bill. Representative Campbell, we have seen you wait all morning for civil justice, and now we're going to get some justice. You're going to get your bill heard.
Thank you, Mr. Chairman. Thank you. All right. Thank you, Mr. Chairman. House Bill 115 changes the allowed weekly attendance time for a child to be in a Parents' Day Out or similar program operated by a religious institution or organization from not more than 2 days in each calendar week for not more than 6 hours each day to not more than 12 hours within a calendar week. This allows more flexibility for them with their own schedule. And I'm sure with the pandemic and the precautions and all of the things that we've seen, this flexibility will be ultimately helpful for the programs that meet this criteria. Thank you, Mr. Chairman.
Any comments or questions about the bill? If not, we'll be voting to send this to the full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you.
House Bill 1344, number 7, by Representative Chairman Ogles. You're recognized.
Thank you, Chairman, members of the committee. And I do apologize for filing a piece of legislation that looks like a caption bill and opening it up 25 titles. But the bill does exactly what it says it does. It instructs TASER to perform a study on childhood obesity and the short-term and long-term socioeconomic impact of the state of Tennessee. And members, the reason I wrote this bill is from the time I've been here at the House, I guess the first time I heard about our figures in Tennessee, Tennessee was the 50th state in the nation. We were actually the worst in all of the states for childhood obesity rates. Since I've been here we're going on 3 years, that number's fluctuated, but I've never seen us go higher than 47th. We're consistently the worst performers in the country for our childhood obesity rate, and you as members of this committee know better than anybody the long-term effects that can have on our citizens of the state. This bill simply instructs TASER to study this issue and give recommendations to how, as a state, we can combat this in the future. Thank you, Chairman.
Do we have any questions or comments on the bill? Chairman Marsh?
Thank you, Mr. Chairman. And my question is, have you talked to anyone at TASER to see if they want to or are able to do this?
Yes, sir. You're recognized.
Thank you, Chairman. I have not reached out to them specifically, being on finance and hearing their presentations every year. I know they've done comprehensive, long, complex studies. I think this very much falls within the realm of their expertise, and if anybody's capable of doing it, I would hope they would be. Thank you, Chairman.
Oh, pardon me, Chair Lady Smith.
Thank you, Representative. I know that, is it Mr. Lippert? He's here, he's with TASSER, and I didn't know if, because I will speak from experience. I had one of the first healthcare studies that they had done since 1994, and I didn't know if it would be of the interest of the chairman just to have him make some remarks on what TASSER could potentially do. And my question is, has the Department of Health weighed in metaphorically or literally on this?
Chairman Ogle.
Thank you, Chairman. I think because of, and then this is kind of my drafting area, because it looked like a caption bill, I've been asked about 100 times the last 2 days where the amendment was for the bill. But so I don't know that everybody actually had time to put their arms around this, but I did open up almost every department in the state that may have some ground with this, so we could start the conversation on this issue.
If there are no objections, we will go out of session and hear from that mysterious world of TASSER that we've all heard so much about but seldom been involved with. And we're out of session. If you'd come and identify yourself. I've been told that I think yearly we do 3 TASSER studies. I think it's limited to 3 or something. So if you could just illuminate us on that.
Thank you, Mr. Chairman. I'm Cliff Lippert. I'm the Executive Director of TASSER, or the Tennessee Advisory Commission on Intergovernmental Relations. So if I take this off while I'm...
Pardon me?
Yeah, thank you. I'm having a hard
Yes,
time
sir.
understanding myself.
That'll be fine.
Cliff Lippert, TASSER, Executive Director. It's not a hard limit, Mr. Chairman, on the number of studies we get, but there's a capacity limit on how many we can effectively do. And so there has been some concern with leadership on which studies come to us and how many studies come to us each year. And the number of studies we can do depends on the size of the study, the complexity of the study. And one of the concerns is making sure that any studies we receive are within the duties and purposes of our statute, which are intergovernmental, so that's a lot of things. I do know that the leadership, my understanding, the leadership is supposed to be formulating a new referral process for studies coming to us. I'm not sure exactly what this is going to look like. There was a process that was going to be implemented last year before the COVID pause made that obsolete, and that process would have sent all the potential TASSER studies to calendar and rules, where they would be then considered and ranked by priority and determine which ones would come to us. As far as this particular issue, it's not something we've looked at before, but most things we are given are not things we've looked at before. And it's certainly something that we would be interested in studying and determining what the intergovernmental aspects of it might be.
Okay. Do we have questions or comments? Anybody questions or comments on the TASSER? And that's wonderful to hear those facts, because you are quite mysterious to most of us and one step above general subbing a bill or summer study.
We like to think we're preferable to that.
I would hope, yes. So no other questions. We do appreciate your testimony, and thank you for being here.
Chairman.
We're back in session on the bill, and let me say that we have so many issues that have come up about the COVID pandemic, about certain issues of the variability of race and ethnic consequences, and one of the issues has come to view that it has to do with obesity. Obesity is one of the biggest factors in the people that get and have difficulty with COVID. And so I think this is very appropriate to search that out. So further comments or questions? Representative Freeman, you're recognized.
Thank you, Chairman. And you stole some of my comments, but I just want to thank you for bringing this. So much of what ails the populace today is through obesity, and I hope that wherever this study ends up, that we start to come up with some solutions for the residents of the state. So thanks for the work on it.
Thank you. Further comments? If not, we'll be voting to send this to full committee. All those in favor say aye. Any opposition? So approved.
Thank you, Chairman and members of the committee.
Thank you for saving the world. We'll move on to item 8, House Bill. I'm not even going to say this. I'll let the sponsor say it. I'll call it Senate bill. Yeah, Senate Bill 1493. Have proper motion and second on the bill from Chairman John Wayne Wendell.
Chairman and members, this bill simply authorizes disabled veterans who have a service-connected disability of quadriplegia to be prescribed cannabis oil. That's all the bill does. I've got an amendment that was filed that takes care of the issues that the Tennessee Medical Association brought to me. Dr. Kumar was kind enough to suggest some amendments, or an amendment regarding FDA regulation of cannabis oil, which I'm going to have drafted between now and the next week. And I've also received communication from several veterans groups in Knoxville, Nashville, Memphis, Chattanooga, Tri-Cities, and they've asked for paraplegics to be included in this bill. I've got that amendment drafted. I'll have it filed today. But this bill simply allows the extract of the cannabis plant to be used by veterans who had the unfortunate incident of being service-connected quadriplegics as a result of service in the armed forces of the United States.
Okay, if there's no objections, we will allow this to, hang on just a minute. Should he take it off notice and put it back on?
I've got that.
Oh, I'm sorry. I misunderstood. I thought you wanted to roll it a week and put the amendment.
Mr. Chairman, I wanted to make the committee aware of what I'm trying to do. I've got one amendment today, but I'll just hold off and run it next week. But because there's no, I'm subject to the will of the chair and the committee.
Chair Lady Smith.
Would you Mr. Chairman, may I ask a couple of questions based
Sure,
on your opening overview?
Yes, go right ahead.
Thank you, sir. I do want to support your bill, but I have some questions about, you mentioned the term prescribe, that you want us to allow those that with quadriplegia that have had this diagnosis as a result of a service injury to be able to be prescribed it. But in this state, is there... explain that use of the term prescribed, because right now it's still a Schedule I drug, and because this has a THC that's present, I want to understand and have that part of the record as the bill travels.
Let me say, I think you meant recommend, because even in states that have medical cannabis, they don't prescribe; they recommend.
My bill will require, with the amendment I'm going to draft, to have a letter from a physician, because what I hope to accomplish is to have a VA certified physician, because the VA has contracted out a lot of physicians, as we know. And if you're a veteran, you don't always go to a government VA facility, because you can go to Tennessee Valley or whatever contractor that you use. It's my hope that we get the bill in a posture that the veteran would have some type of authorization. We can call it a prescription, we can call it whatever, but what I'm trying to avoid is veterans deserve access to cannabis in a liquid form. If you're a quadriplegic and your legs are blown off or you lose use of your arms, in Iraq or Vietnam I mean, it seems unfair for this body to say that woman or man can't have access to an extract of a plant that's grown in Tennessee. So whatever I have to do with the committee to make it palatable to the committee, to make sure this is a bill that's simply crafted to help disabled veterans. This is not about smoking marijuana. This is not about making recreational marijuana legal. But veterans groups where I live, and I think I can speak for most of Tennessee, it's time for us to get past the point where every cannabis bill is classified as a medical marijuana or a recreational marijuana bill. This simply allows the extract that's boiled down from the cannabis plant to be used by somebody who has no use of their body below their throat. I mean, is that asking too much that somebody in Kentucky, Indiana, Florida can get the same prescription or get the same medication, and Tennesseans who served our country can't get it because we've taken a posture that all marijuana products are terrible because there's somehow some kind of illicit drug use? And I hear the complaints. It's an entryway drug, and it certainly is. I wouldn't disagree with that. And also that it's going to be abused by people. But I don't think that somebody that's confined to a wheelchair, that's paralyzed from the neck down, is going to be abusing cannabis oil, and that we need to be worried about that possibility. I mean, I'm not worried about my veterans who are paralyzed from the neck down causing problems for my community, because they don't.
And Chair Lady Smith is...
Thank you, Mr. Chairman, and those are your words, not mine. I don't have a fear. I've actually administered Marinol.
Oh, I think we're on the same page.
And so,
certainly.
no, we're on the same page. I just want to make sure, because I see our friends with law enforcement that are here from the Department of Safety, and I know that as Dr. Kumar has stood in the position that you're in just a few weeks ago or last week and introduced a resolution that we want our federal partners to remove the Schedule I designation so that research can be done, because we're setting up a construct where we're breaking federal law, but we're permitting something that's important to treat the population that you just mentioned. I would just note for the record, though, that as you're citing as an example someone that's quadriplegic, you mentioned too already lowering it down to someone who's paraplegic. And I would just caution that there is a very vague definition and code of hemiplegia, which includes sexual dysfunction. So we want to make sure that we hold the line and serve our veterans to make sure that we don't keep lowering the bar and making this more of a wide open bill. But thank you for the indulgence, Mr. Chairman.
Let me kind of jump in here. Apparently, we've got some questions. And a bunch of hands are going up. Do you want to roll this a week?
Well, I just soon take the questions today, and then I'll try to have those answered by next week, or I'll do whatever the committee chair wants me to do. I've got great respect for him and whatever he wants me to do, I'm at the will of the committee. This is simply an idea that was given to me by a veteran I'm not going to name. I think that's probably not fair. But, yeah. I mean, I'm satisfied with what the committee does, but if we want to discuss it today, I'm prepared to do so. Dr. Kumar is certainly an expert. I think Robin Smith's an expert on this topic. I think Darren Jernigan can be recognized as an expert by the chair.
We've got a couple of people waiting here from your party, actually. But
I'm totally flexible.
Yeah, let me, I think we're kind of poking in the dark here on a couple of these items. So let me, unless the committee wants to do otherwise, let's roll it a week, see if you can come back with those amendments. And in the meantime, check with these folks. You know who's going to be asking the questions about it.
I'll make a point to do that, yes, please.
So if that's okay, and no objections to that, and that'll cut off debate. And if you want to talk to the sponsor and maybe come up with an amendment or something that we can work on for next week.
I'm totally flexible. I just want to put the issue before the General Assembly like I committed to do. And once I do that, I fulfill my commitment. I'll be satisfied with whatever happens.
If there are no objections, we'll just do that. We'll roll it till next week. And you're welcome to use the staff here at any time to put together your amendments.
Then I will be, if I could finish up with one comment.
Okay.
If I could ask the staff to come up with an amendment that satisfies, I think Robin Smith has some excellent points, and I respect her a great deal. Dr. Kumar, I respect a great deal, and Darren Jernigan. If the staff could please talk to those three representatives, along with myself, and craft an amendment that may be satisfactory to this committee, because and I'm not here to make a speech about this, but Tennessee's either going to be 50th, they're going to be 42nd, 43rd. This is coming, so why should you penalize a Vietnam-era veteran who may never get the benefit of this by punting this down the field?
Sure.
But anyway, that's enough said by
Understand.
me.
So we'll roll this till next week. I'm getting a little bit nervous. There's a majority of Democrats in here now. We have Mike Turner that showed up in the back, and he counts for 3 Democrats right there all by
Mr. Chairman,
himself.
but before the resolution to abolish those people was passed, I'm going to go ahead and leave the room, okay?
Clear the halls. Yes, sir, thank you. We have, I think, item 9, 460 has been rolled 2 weeks. We have item 10, House Bill 455 by Chairman Thompson. You are recognized. Have a proper motion and second on the bill.
Well, thank you, Mr. Chairman and committee. This is HBO 455. It's a bill to include Tennessee in the Psychology Interjurisdictional Compact, or PsyPact as is known as for short. The compact is designed to achieve the following purposes and objectives. That's to increase public access to professional psychological services by allowing for telepsychological practice across state lines, as well as temporary in-person, face-to-face services into a state which the psychologist is not licensed to practice psychology. To enhance the state's ability to protect the public's health and safety, especially client-patient safety, to encourage the cooperation of compact states in the areas of psychology, licensure, and regulation, facilitate the exchange of information between compact states regarding psychologists' licensure, adverse actions, and disciplinary history, and to promote compliance with the laws governing psychological practice in each compact state, and invest all compact states with the authority to hold licensed psychologists accountable through the mutual recognition of compact state licenses. Now, this was initially brought to the Veterans Caucus. I'm a member of that. By an official from the Department of Defense. Licensure issues impact both transitioning military members and their family members. Occupational licensure compacts provide consistent rules that allow licensed members and their spouses to work in other states through a privilege to practice, or in other words, more easily ability to transfer their license to a new state. Hold 1 second. Tennessee has similar compacts now for EMTs, nurses, and physical therapists. Of course, it affects not just military members, but the general public needing these services as well. Currently, 15 states have entered the compact, and 15 more states have pending legislation at the present time. Board of Examiners in Psychology have voted to endorse this legislation, and the Senate has passed this legislation already.
Do we have comments or questions of the sponsor? There are no amendments. Okay. And I've been told the value of this this measure. and the fact that we've worked on it for a while, and the Department of Defense is interested in it. Is any comments or questions? If not, we'll be voting to send this to full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, Chairman Committee.
We're on House Bill 789, item 11, by Chairlady Cooper. We have a proper motion and second on the bill. You're recognized, Chairlady Cooper. Now, while she's getting up there, in just a moment, I'm going to take a privilege when we take care of her bills. My bill on the last item on the calendar was rolled from last week, and it looks like it's probably going to be rolled again this week. So if there are no objections, I'd like to jump that up and hear that bill once we take care of these two items. If there are no objections. You, Chairlady Cooper, you're recognized.
Thank you, Mr. Chairman and members. House Bill 789 does just what it says here. It requires the Department of Health to post on its website information from the Centers of Disease Control and Prevention concerning the health effects and dangers of persons using vapor products, and requires the Department of Health, in coordination with the Department of Education, to disseminate this information to students in public middle schools, junior high schools, and senior high schools. And I do have some astounding research that I found about this. This came from Senator Gilmore, and I didn't know whether, I know the time is of essence, but it tells us that according to a 2019 survey, more than 5 million United States middle and high school students use e-cigarettes in the past 30 days. This comes from the United States Food and Drug Administration in 2019. There's quite a bit of research on how these children are being exposed to e-cigarettes and how it sends them on to smoking just cigarettes, and then on from drugs and some, and then maybe child abuse or whatever. So I'm hoping that we can try to deter some of this environment by our youth and by the department placing it on the website and any other advertisement that we can do to let them be aware, the parents, community, or whomever. So if there are any questions, I'd be glad to ask them. And and it's just simple.
Okay. I think Leader Marsh, did you want to?
Thank you, Mr. Chairman. And I agree that we're having a real problem with this, and we need to do everything we can to slow it down and to put information and education out. I talked to the department, and they told me that they were already doing a lot of this, and I just wondered if we really needed it now. Like they told me they're already doing it, it's already online, so I just want to make sure we're not double dipping here.
You know, I didn't speak with the department. It comes from Senator Gilmore, and I would suspect that we can, I don't know whether it's on the website or not. I really don't. But I can inquire and see if it's on the website, because that's the main thing, and also distribute it to our children. Right now it's COVID, and a lot of them are just at home teaching and so forth. It may not be, some of them are going back this week, later on in the classroom, but I just, if it's already doing it, they have it already on the website, then we don't need to try to put another one on there.
Chair Lady Smith, did you?
I just want to echo Leader Marsh's comments, and I do think the department's doing a really good job of trying to promote this, because this really doesn't come down to vaping, it comes down to addiction. Our colleague, Representative Freeman, really hit this in an earlier time. For adults that are older, smoking cessation, this is an important tool. However, to introduce our youth with a very concentrated type of nicotine that is bubble gum and candy flavored, to me, it's unconscionable that we're seeing an industry started. But I would join Leader Marsh and just ask if you could, before full committee, check with the department, because I'm not opposed to supporting your bill today, but for the purpose of being redundant and adding something else in code, it may be that it may already be done. So thank you, Mr. Chairman, for my indulgence.
Chairman Jernigan.
Representative Cooper, I think, since we don't know, would you consider rolling it a week, find out from the department whether or not it is on the website? If it is on the website, you can take it off notice, and if it's not, then we can run the bill. What do you think?
I'm
Chair
at
Lady
the will
Cooper.
of the committee.
Okay.
Chair Lady Cooper.
Yes, thank you for your time and considering and listening.
Is that a motion?
Well, let Representative Freeman speak first.
Representative Freeman.
Sure. Can I make a counter motion? Can we go ahead and pass this to full and let her do the work? I think everybody probably is in agreement, and if it's redundant, then we can address it in full.
Any opposition to passing this to the full committee with the understanding that that information will be found out before next week?
Well, Mr. Chair, I'm sorry.
Yes, ma'am.
I was just going to say, if we find out before next week, I'll be happy to
Sure.
notify your office.
Okay.
The committee.
So we have, and we already have a motion second on the bill. If there are no objections, we will be voting to pass this to full committee with the understanding that we will get that information by next week. All those in favor say aye.
Aye.
Any opposition? So approved. You're recognized on House
Thank you, Mr.
Bill
Chairman, members.
1091. Have a proper motion second on the bill.
Thank you, Mr. Chairman and committee. 1091 is a bill that we had last year, and it simply removes restriction on appointments to the Board of Dentistry for persons affiliated with educational institutions where the practice of dentistry, dental hygiene, and dental assistant is taught. Now that we have changed that, where people who are teachers will not be testing. We'll have some experts from other areas to do the testing, and it allows teachers to serve on the Board of Dentistry now. So I'm asking that you consider this bill so teachers can be at the table when they make decisions. And also that we have Mr. Green here who could give you further information if so necessary.
Well, and that's exactly right. We passed this last year. I think this bill came up. In the past years, there were two categories of people that were not allowed on the dental board of examiners, the equipment salespeople, and the dental school faculty. And of course, this doesn't demand that either one of those change. But it does open up the ability for dental school faculty to serve on the Board of Dentistry. And they're very valuable members. It doesn't require that they be Board of Dentistry or doesn't require that they be dental faculty. And the reason is that examinations in the past were given by the dental faculty to dental students for state board exams. But here in the last years, probably the last decade, they've been done in a regional manner. So these people are not giving the examinations to the dental students. So essentially, all that's changed, and the Board of Dentistry just wants to be able to have the governor appoints these people and have them nominated as well as the rest of the public. So I think that explains, isn't that accurate?
Yes, sir. Thank you, Mr.
Yeah.
Chair.
Any questions or comments? Do we need to go out of session? If none, we'll be voting to send this bill to full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, Mr. Chair and members.
Thank you, Chair Lady Cooper. And we go to item 13, House Bill 441 by Representative Lamar. We have a proper motion and second on the bill.
Good afternoon, committee.
Good afternoon.
Is there an amendment that's on the bill? No, it's been
Is
updated
there
with
an
the Department of
amendment?
Health? Okay,
No
great.
amendment. Do you wish to place one on it?
No, just making sure. I am presenting HB 441. According to the United Health Foundation in 2020, Tennessee was ranked 6th in the nation with an infant mortality rate of 7.3 per 1,000 births. In Tennessee, the infant mortality rate for Black women is 11.3 per 1,000 births. While in Tennessee, the infant mortality rate for Asian women is 5.6, Hispanic women 5.8, and white women 6.2. And while the national average is 5.8, Black women have an infant mortality rate of 11.3. In Tennessee, it's imperative that we start a task force to take a closer look at what makes the infant mortality rate for Black women nearly double the rate of every other racial group throughout this state. Taking this major step forward, understanding the health issues that affect the lives of pregnant Black women is how we can show through our actions and words that we value Black lives the same as all others. This one-year task force has the potential to save hundreds of lives in Tennessee and possibly throughout the country. For these reasons alone, we should be willing to put available resources forward to do this study. And that is an explanation of my bill.
Okay. Do we have comments or questions of the sponsor? If not, I do have information that was given to me from the Department of Health. They understand the intention, but the way that it's written is relative to perinatal care, and they had recommended an amendment to clarify that the bill falls under the Department of Health, which they have some question about. There are existing programs at the Department of Health that pertain to fetal infant mortality. They have a fetal mortality review that's age old. Your bill supports a focus at Tennessee Department of Health, but it would duplicate what they're doing at the moment. The infant mortality review program is a community review process that reviews fetal and infant deaths, working at a community level to formulate programs and influence the policies of the state that'll lead to improving the outcomes. I just felt like I had to give these responses from the Department of Health, and I'll open it for discussion. Or yes, you're recognized, Representative Lamar.
Absolutely. Thank you. If I'm not mistaken, I submitted an amendment to clarify, because the way the legal wrote the bill, they forgot the word health after commissioner. Mm-hmm. So I've submitted that bill last week, and what I can do is go back after this to re-forward the email. But I did submit that amendment from the Department of Health to clarify, to put the word health commissioner. They left off commissioner of health in the bill language, but it's intended to be under the Department of Health. Also, to address the Department of Health's comments, I looked under their program. There's no specific study for Black women alone. And based on the statistics, the death of infants for Black women is double than any race in this state. And so there needs to be a specific focus on how we can reduce the infant mortality rate amongst this particular specialized group, because of the fact that it's double than anybody else. And what are the factors that are mitigating the fact that African American women are losing their children at double the rate than any other group here in the state? And so they're focusing on everybody. This particular bill is asking to focus on one particular group so that we can figure out how we can mitigate those infant mortality deaths, because they don't mirror any other race of any other racial group here in the state of Tennessee. So no, it's not duplicate work. It's asking you to focus your work on a specific racial group so that they can reduce the amount of their children dying.
We have comments or questions. Dr. Terry?
Thank you, Chairman. Appreciate you bringing the legislation, and I just want to try to work with you on this. You do have a fiscal note on this as it relates, I think, to the task force as it is. And I know that the department does reports on infant mortality. And one way that we might could get that fiscal note off and complete your objective may be not to have the task force, but on their infant mortality report, specifically have them work towards what's the difference in African American versus other demographic groups, why, and put that in there and say, we want to, when we get this report from them, we want that information specified in there as well. And that may get your fiscal note off, may get you from behind the budget. So just some thoughts out there. I mean, it's information that I would like to have.
Mm-hmm.
So some thoughts on that.
That's a great suggestion, Mr. Chairman, and I would be more than happy to work with you and amend that in a way that we can reduce that fiscal note, because I think this is valuable information that you all should have. Absolutely.
We have, are you recommending, excuse me, Dr. Terry, are you making a recommendation?
Thank you, Chairman. I mean, it's up to the will of the committee. I mean, we did not have an amendment that I don't know that was timely filed. The question would be whether the sponsor, whether the committee would like to vote on this as is, work on an amendment, or we want to roll this 1 week, get the amendment in place, and go through. It's at the will of the committee.
Mr. Chairman, I'm at the will of committee, whatever you all want to do.
Chairman Marsh.
I'll make a motion that we roll it 1 week and come back with a correct amendment.
Okay, we have proper motion and second. And let me say the amendment is written. I don't know if it's adequate for what the discussion has been here, but the amendment was written, but it just wasn't filed timely. So did you have a response, Representative Lamar?
I will get those in for you, and I'll see you next week.
We have further comments or questions. We have a motion on the floor to roll 1 week. If there's no objections, we will roll this bill 1 week in expectation of an amendment.
All right.
Thank you. And it looks like we're running short on time here. I'll just go ahead and put my bill off till next week, since we'll have Captain America's bill here. So we'll just, it'll be kind of the same information. And let me say that these are both very serious bills. This issue has been hidden a long time under the facade of criminal acts, and I think it's time that we put a little sunlight on them. So I'll just wait. We'll go ahead and take care of item 14, House Bill 559. Representative Marsh, pardon me, Leader Marsh. You're recognized. I think we have an amendment.
Yes, we do.
Yes. It makes the bill. We have a proper motion and second on the amendment. If you'd like to describe the amendment that makes the bill.
Okay, the amendment drafting code is 4466. And it made some changes that we had in the original draft, and I think that amendment does make the bill now. Do you want me to explain the bill?
We can go ahead and vote on the amendment, put it on the bill if we like. No
Sure.
objections. We'll be voting to amend this bill. All those in favor say aye. Aye. Any opposition? We're back on the bill as amended. Yes, sir. Go ahead and discuss it.
Thank you, Mr. Chairman. This bill concerns certified medical assistants. Medical assistants currently practice under the supervision of a physician at a physician's owned office, performing whatever task is delegated to them by the medical director. However, certified medical assistants are not allowed to practice in hospital outpatient clinics. HB 559 attempts to streamline the process and allow certified medical assistants to perform certain delegated tasks in an ambulatory clinic or hospital outpatient department. I'll be glad to take any questions.
Do you have any questions or comments of the leader, sponsor? If none, we'll be voting to send this bill to, as amended, to the full committee. All those in favor say aye. Aye. Any opposition? So approved. We are Item 15, House Bill 877 by Chairman Terry. You're recognized. We have proper motion and second on the bill.
Thank you, Chairman and Committee. This bill is from the Board of Pharmacy, and it actually passed the Senate last year, and it passed through our House Mental Health and Substance Abuse Committee, but because of the pandemic, we did not finish taking this up, and it will enhance patient safety by ensuring U.S. pharmacopoeia compounding standards are met and delete some redundant reporting requirements. That I ask passage.
Do you have any comments or questions? All the responses I've had have been favorable for the bill. If none, we'll be voting to send this to full committee. All those in favor say aye.
Aye.
Any opposition? So approved. And,
Thank you, Chairman and Committee.
Thank you, sir. Item 16, House Bill 828 by Dr. Kumar. You're recognized. Have proper motion and second on the bill.
Thank you, Mr. Chairman. It was in 2019 that I served on the Alzheimer's Advisory Council, and this bill is based on recommendations from the council. This is a significant problem. It's a disabling condition and can affect some great minds. Pat Summitt comes to mind. By 2030, 1 in 5 Tennesseans will be over the age of 65. At this time, there are 75,000 patients with Alzheimer's in Tennessee and 5 million in the United States. It has been called as the most expensive disease because it affects the patient and the families also. The recommendations from this task force are that the Department of Health, along with other agencies, move to create materials for education, risk reduction, early detection of Alzheimer's disease, timely diagnosis, and options in dementia and cognitive impairment. Using the state and local public health partnerships, it will address dementia roadmap as put out by the Center of Disease Control and the Healthy Brain Initiatives. And it will also provide uniform and consistent guidance to the public in non-clinical terms. The task force will report back in 1 year, and it's an ongoing effort between the Tennessee Commission on Aging and Disability as well as the Alzheimer's Association, and they have extremely knowledgeable and committed volunteers. With that, I'll be happy to answer any questions.
Do we have any comments or questions to the sponsor? If none, we will be voting to send this bill to the full committee. All those in favor say aye.
Aye.
Any opposition? So approved.
Thank you, Mr. Chairman and committee.
We've about run out of time here, so we'll just roll the last bill till next week. And it looks like next week is going to be the cannabis calendar. So prepare yourselves. No comments or questions. I'll stand for a motion to adjourn. So moved.
Hey. Thank you. Great work. Get yours out.
I know.